Hello, this is Dr. Trivedi, a doctor working here in the clinic. May I confirm your name and age, please?
Hi, doctor. I am Margot Rovi and I am 18 years.
Okay, how may I address you?
Please call me Rovi.
Okay, Robbie. Okay, Miss Robbie, today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor. No problem with me.
Okay, well, just before starting our conversation, I would like to know that how are you feeling now? Do you feel too much drowsy to continue the conversation or not?
No, doctor. Now I am feeling good and I am feeling better. I had a fever and now after taking this medications and those injections, I am feeling fine now.
Okay, so we can continue our conversation. Okay, that's
Yes,
all right. Miss Robbie, can you please tell me in your own terms what have brought you here today, or what have caused your problem? May I know?
Yes, doctor. Actually, I am staying at a hostel for the students, and for the last 3 days, I noticed that I am something feeling raised temperature, and I didn't expect that it will go so severe and in a very short time. And that was yesterday night, not night, yesterday evening. My temperature got very high, and I don't know that what happened to me. My roommate said me that I was behaving strange. So they took me to the emergency department, and on the emergency department, they did some test, and they said that I had pneumonia, and also they said that my blood sugar level is very high. So they are suspecting that I have diabetes mellitus. On the emergency department, they gave me some injections, some antibiotics for my pneumonia, and they said that I need some consultation if I have diabetes or not. So they referred me here.
Okay, I can get you. And may I know that when did the fever started? Yesterday.
No, it was 3 days
Raised
ago,
temperature.
but the bad thing happens yesterday.
Okay, that's all right. Did you measure your temperature? Raised
No,
temperature? How raised? What is?
no, I just took
Okay.
some paracetamol tablets from the pharmacy, and that initially that helped me a little.
Okay. Okay. And may I know that was there any rituals and rigor present
Yes,
with
doctor.
this raised temperature? Okay. And any sweating?
Sweating was present when I took this paracetamol.
Okay. And may I know that you tell that there were some problem with your senses, I think. May I know that did you completely lost your consciousness, or there were any
No,
problems in your
no,
consciousness?
there was something problem that I couldn't remember properly. I couldn't contact my roommates, and in a proper way, I was talking something that is some irregular thing. Just they said that they were asking me one thing, and I were not answering or even answer the wrong thing like that.
Okay, okay. Okay, that's all right. Can you please remember that did you had any headache at that time?
No,
Okay, any rashes in your skin or in the body?
no,
Okay, any stiffness in your neck movement? Any problem in your neck movement at the time or since yesterday?
no.
Okay, that's all right. Well, you told that actually in the clinic they found that it was pneumonia. May I know that did you have any cough?
Yes, doctor.
Well, for how long?
3 days,
For
and
three
also
days.
chest pain. I
Okay,
had chest pain.
chest pain. Okay. Let's go with cough first. When did it first started? 3 days back. Did it come along suddenly or gradually?
Suddenly.
Okay. And was it dry or did you produce any phlegm?
Produced film, doctor.
Okay. Can you please remember that whether I think it's a bit embarrassing, but we have to ask that is it was it thick phlegm or any color present, yellowish or brownish, anything like that?
Thick, and I think it was yellowish.
That's all right. And any blood have you
No,
noticed? Okay. Was this cough being produced all the time for the last 3 days, or there were any variation during the day or night?
whenever I coughed, I produced phlegm.
Okay, that's all right. And you told that you also had some chest pain. Well, can you please tell me exactly where was the pain?
On my right side.
Okay, and when did it start? 3 days back?
Yes, doctor.
Okay, and how long did it persist? Did it come along suddenly?
Yes.
Okay, and how long does this pain persist?
For the last 3 days before taking
Okay,
this
continue.
before admitting into this hospital, I had this. So
Oh,
taking
yeah.
paracetamol just helped me.
Okay, so it was just a continuous pain. Am
Yes.
I right?
Yes.
Was there anything that made it worse, like taking a deep breath or something like that?
Somewhat taking a deep breath made some the
Okay,
pressure over the area somewhat.
okay. So can you please describe the pain for me?
It was dull and continuous pain.
Okay, and did it radiate to any other site?
No.
Okay. Well, actually, may I know that did you have any chest tightness?
No.
Okay. Well, may I know that this cough episode is this for the first time, or was it present before also?
No. This is the first time.
Okay. And have you ever been? I have to ask this. Have you ever been in contact with any tuberculosis patient? Do you know of any?
No.
Okay. And may I know that had you? Okay. And may I ask you some questions actually? That what about your water work?
For last couple of months, I noticed that I am passing more frequently, and also I usually is a deep sleeper, and when I sleep, usually I don't wake up. And for last 2 months, I had to wake up 2 to 3 times every night to pass my water.
Okay. Okay. And may I know that has this been the same in the last 2 or 3 months, or has this problem been increasing?
It is increasing, doctor. Even now, I have
Okay.
to wake up about sometimes 3 or 4 times.
Okay. What about your drinking habit? Has this been same, or do you have to drink more water?
I have to
What
drink
about that?
more water, doctor, because actually I am recently I have recently taken part into the sports department, and I have to take a lot of stress and a lot of exercise. So I need to take a large volume of water.
You have to take large volume of water. Okay. And okay. And what about your food habit? Do you have to? Are you eating more or less, or same as before?
I am eating more, doctor, as I have enrolled into the
Okay.
sports
Yeah.
take more.
Yeah. I can get it. I can get it. Well, may I know that how is about your weight? What's about your weight?
I also lost a few kg weights over these last 3 months, and I think all this was due to this excessive exercise.
Excessive exercise. Okay. Well, have you measured how much weight have you lost
Yes, doctor, 5 kg over the last 3 months.
over the last 2 months? Okay. Was it intentional? I think it's unintentional since you are eating more, I think.
Yes, doctor.
Okay. Okay. And okay. And may I know that do you have any problem in your vision?
No.
Okay. And you told that you have to pass more water work, but may I know that is there any changes in the pattern of water work, like any frothiness or something like that?
No.
That's all right. And may I know that do you have any chest pain other times as well, just not beyond this time?
No.
Any other chest pain? Okay. Any racing and pacing of your heart?
No.
Any shortness of breath?
No.
Okay. May I ask you some other questions? So do you have any redness in your eyes? Have you had any episodes of like that? Any redness?
No.
Okay. Any joint pain?
No. Somewhat
Okay.
muscle
Any
ache after taking exercise. Nothing significant.
okay. Any rashes in your body?
No.
Okay, have you ever had any head trauma?
No.
Okay, that's all right. And any weakness in any parts of your body or any abnormal sensation in any parts of your body?
No.
Okay, any difficulty in swallowing or speech?
No.
Well, have you ever had any episodes of indigestion?
No.
Have you noticed? That's all. And okay. And do you have any leg cramps or any leg pain? Have you noticed?
No.
Okay, that's all right. Well, okay. And may I know that do you are you on any medication?
No.
Okay. Any allergy to any medication?
No.
Any over-the-counter medication?
No.
Okay. It's a bit personal question, but I have to ask. Do you take any recreational medication?
No, doctor.
Very good. And well, now it's important to ask that do you have any history, any significant history, disease history of yourself?
About 6 months ago, I heard also that is called some infection, that is a respiratory infection. Doctor said with that, and taking antibiotics and some antihistamine improve that symptom.
Okay. Okay. May I know that which antibiotic did you take? Do you remember?
Ciprofloxacin, I think.
Okay. Okay, that's all right. And you took that for how long?
7 days.
Okay, that's all right. And since then you had been well. Am I right?
Yes, doctor.
Okay. And may I know that do you have any history in your family of having diabetes or any
Yes,
high blood
doctor.
pressure or anything like that?
Yes, doctor. My
May I know
mother
who?
has also diabetes. My mother has diabetes, and also my grandmother has diabetes, and they need to take
Okay,
insulin regularly.
they have to take insulin. Okay. May I know that at which age were they diagnosed? Do you know of any age of them?
Yes, doctor. They were diagnosed. My mother was diagnosed when she was 20, and I don't know about my grandmother, but she also was diagnosed at a very early age.
Okay, at a very early age. That's all right. And what about your father?
He's well.
He's well. Okay, that's all right. And okay, I have to ask you some other personal questions. Do you smoke?
No.
Do you drink alcohol?
No.
Okay, and do you drive actually?
No.
Okay, you told that you undertook sports. Are you involved in any other job activities for your well-being?
No.
Okay, and may I
Please
know that
really.
have you been to travel to any other country recently?
No.
Okay, I'm just going to ask you another personal question. Are you active sexually?
No, doctor.
That's all right. That's all right. That's all right. And okay, and may I know what your concerns are?
My doctor from the emergency department thought that I have diabetes. Is it diabetes, or you are thinking because my mother has diabetes?
Well, at this moment, we have to at first run some specific tests and also may do a detailed examination of you to give you a very proper answer. But as long as I have taken history from you and also your present symptoms and also some symptoms that you carry on from your family, I think that it's highly likely that you are suffering from diabetes. Well, actually, are you getting me?
Okay, doctor.
Okay. However, we will involve the diabetic specialist and our consultant also to do the test as soon as possible and map out a plan which is better for you. But I think that there are actually several types of diabetes. Would you like to know about it if I tell?
Okay, doctor.
Well, actually, there are specifically two types of diabetes specifically, and one is more common in the younger age. It is type 1 diabetes. I think that you might be suffering from this. Okay, and however, we have to be confirm about it. But there is
That I will need to
modern
take
treatment.
insulin.
Okay, well, if it is diagnosed as type 1 diabetes, I'm afraid that you might have to be
Doctor,
treated with
I am living at a student hostel, and also it is very difficult for me because I saw my mother sometimes become unconscious because she takes insulin. And if it happens to me, who is going to
Yeah.
take care of me? Time up.
Yeah. I can understand. Well, actually, we know that every medication has some drawbacks and some
Time
advantages.
up.
And okay, shall I continue or stop?
Let's stop.
Okay.
So, what is your diagnosis? Is it diabetes or not?
I think it's diabetes here. I think it's type
What
1
are the
diabetes.
points in favor of your diagnosis?
Well, I think first of all, uh, her altered consciousness in response to this fever, and then the finding of high blood sugar in a random blood test, and also her recent change in her urination tendency as nighttime awakening to urinate, and predilection to have more food. And I think these all combine the chance that this is more of a case of the type 1 diabetes mellitus, and also considering her significant family history.
Okay, so you are suspecting that it is a type 1 diabetes mellitus.
It is diabetes mellitus, I think. Yeah.
Okay, wow.
Oh,
What are the pathology for type 1 diabetes mellitus?
I think in type 1 diabetes mellitus, I think it diabetes mellitus. I think it might not be type 1 as well. But however, in type 1 diabetes mellitus, there is destruction of pancreatic islet cells. So there is absolute deficiency of insulin. Okay, so I think that is the pathology.
Okay,
I can't remember fully. It's usually an autoimmune pathology, I think.
okay. So you're telling that it is autoimmune pathology. So have you ever searched or have you searched for any other autonomic features in this lady?
I just asked about
In this lady?
rashes, joint pain. That's all.
Okay. And can it be a part of autoimmune polyglandular syndrome?
Yes, of course.
Have you searched for that?
No.
Okay, that's
Yeah.
not a problem. And how will you investigate her?
Well, at first I have to do some routine blood tests like CBC, ESS, CRP. Then I will have to go for again blood sugar level, then HbA1c, and I have to go for OGTT, and then I will have to go for renal function test along with serum creatinine, liver function test, and also I have to do chest X-ray PAVU again to see the condition of our pneumonia, I think, and I will also have to take take advice from the endocrinologist and the medicine specialist. And also, then after confirming diabetes, I have to go for the type and cause, like some antibody or autoantibody profiling, like I think islet cell antibodies, I think, and I2 antibodies. I just can't remember totally now.
Okay,
These
that's
antibodies.
okay. So you are telling that and you're going to do this test. Is there any specific test?
Uh, uh, I just can't remember. Sorry, no.
For diabetes?
Specific test.
Any specific test or any single test?
OGTT with 2-hour glucose monitoring, I think.
Okay.
and HbA1c level to see the 3 months
Okay.
average.
HbA1c, okay, that's fine. So how will you manage her?
Well, at first we have to do the patient education and counseling. Then actually we have to form a multidisciplinary team here, involving the endocrinologist and maybe occupational health services also.
Why?
And then because of our sports involvement recently,
Okay.
and because we might have to think about what sports should she do, or what can
Okay,
be
then?
done. And then at first, since she is now admitted on emergency department, we have to at first deal with her acute problems at first. Okay.
Okay, I am asking that how will you manage her diabetes?
Okay, for the diabetes management, at first we have to find out the type of diabetes. It can
Suppose
be,
type 1.
suppose type 1. I think it's important to go for insulin, and I think we should, for type 1, it's better to go for basal bolus insulin regimen, that 3 times insulin,
Any other
short
management?
acting. And for at first patient education counseling, then some non-pharmacological management also, like changing of lifestyle. Okay. uh, and and then going for pharmacological treatment with insulin, I think.
Okay. Do you think that she needs any dietitian advice?
Yeah, of course. In the non-pharmacological segment, it's important for her to have some dietitian advice.
Okay. And I am asking a few more questions relating to her condition. What do you think that why she has lost or she has altered consciousness?
Well, I think decay is a cause here. Diabetic ketoacidosis can be a cause here,
Okay.
which can
Suppose it,
which can
suppose
actually,
decay. Did you
yeah,
went for any test for decay, or do you want to do any test for decay?
yeah. I think if it's decay, I think we should go for uh, serum pH, a bicarbonate level, lactate level. These are maybe important.
Okay. Suppose it is this lady has DKA. What are the complications of DKA?
Yeah, I think this one that she presented, this problem with altered consciousness, and also I think I just can't remember totally. I think cerebral edema is also very detrimental consequence, I think.
No. Okay.
And sorry.
Suppose,
Yeah,
do you think our acute kidney injury?
yeah, acute kidney injury can
Have
also
you
be important.
asked anything for that? Any question for that?
Well, I just asked about her water work, and it was all right. I think she told.
Okay. You haven't been specific. She doesn't know that what is normal. Not passing water for 12 hours or more. She doesn't know that is it normal or abnormal. And also she has altered consciousness.
Yeah. Then what should have I asked?
Okay, for the history taking, I think it was something bad for you because
Yeah.
at this stage, such type of history taking was somewhat disappointing for me, and you lost 5 minutes
Yeah.
by asking
Yeah.
about her
Mm-hmm.
pneumonia diagnosis.
Yeah.
The concern from the emergency department was, is she diabetic or not? Because they ran blood test 2 times and they found
Yeah.
that she has high blood sugar.
Mm-hmm.
So it is most likely that she has diabetes or some
Yeah.
stress hyperglycemia. They have sent for evaluation for her hyperglycemia. Is it
Mm.
uh,
Mm.
is it just a stress hyperglycemia or is it a diabetes? If it is
Yeah.
diabetes, if she needs any urgent treatment or not.
Yeah. Mm-hmm.
Okay, so you are asking
Yeah.
about the pneumonia. Pneumonia wasn't in concern.
Yeah.
Already they said that they
Okay.
diagnosed pneumonia.
Mm.
Okay,
Mm. Mm.
so you take the history for her recent events. That is fine. That what happened.
Okay.
That is,
Mm-hmm.
and after that,
Mm.
as she has high blood sugar level, so you should go for symptoms for diabetes mellitus
Yeah.
first,
Mm.
not we going to the pneumonia first. And after going for
Mm.
the diabetes symptoms of diabetes, then you should go for the complications of diabetes mellitus if she have any.
Mm.
Then cause of her diabetes, is it type 1 diabetes, type 2 diabetes, or it is a part of
More
polycystic
diet.
liver syndrome?
Mm.
Okay.
Mm.
And after that, you have asked about family history. That's fine. And also, this lady has a lot of concern to be met. But as you lost your time earlier, so
Mm.
couldn't get much time. She
Mm.
needs taking taking insulin urgently, otherwise she will not be fine. And also, she has a significant history of respiratory tract infection or some viral infection 6 months back that may provoke type 1 diabetes mellitus. Did she have
Yeah.
any altered consciousness at that time? Did she have any
Mm.
abnormal breathing at that time? So you could
Mm.
get a better
Mm.
idea into this. Okay. And also, this type of patients should be warned about that we need to involve dietitian. They may give you advice on the diet, and also need take some advice on your exercise, because all type of exercise isn't good for her. She should avoid some type of exercise, and before strenuous exercise she may, and during exercise she may lose consciousness, or she may have some effect due to her diabetes. You haven't asked for that. And even during her diabetes exercise, if she have felt any abnormality, you haven't asked that. That was this was issue also. So lots of points to be asked, or also lots of concern to be made.
Hello.
Hello.
Mm.
Okay.
Well, I have some questions here. First of all, since the first symptoms, how should I progress in these type of cases, like fever and chest infection? Shouldn't I ask anything about it?
She you have to notice that what is the concern of the GP, or what is the concern from the emergency department.
Okay.
And if relevant, you should go for,
Okay.
if relevant, you should go for the present symptom. Already she is diagnosed with pneumonia, so for this
Okay.
lady you shouldn't spend much time on diagnosing pneumonia, because you are not you are not requested to diagnose her pneumonia. You are requested to diagnose diabetes mellitus, and already on the emergency department they are thinking that she has diabetes. Actually, they have sent you for the confirmatory type diagnosis, and also for finding any type of secondary issues present or not, and and somewhat counseling, for counseling. Okay.
Yeah. Okay. So okay, that's all right. I have another question. So that is the experience regarding her strong family history. Should it be MODI, majority onset diabetes of young?
That usually involves another question, that she is taking insulin. You should have asked that from the diagnosis. Do you know the type of their diagnosis? Was it type 1? Did they need insulin from the childhood, or did they need to take some oral or some tablets previously, and now they are taking the insulin?
That's very important. That's a very big question that I missed, I think. Okay. And Okay, did they have to use insulin or from beginning or some oral medication? Is that right?
Yes.
And okay, and then okay, and for autoimmune polyendocrine syndrome, what should have I asked? I think candidiasis
Yes.
and
Candidiasis and for
Addison.
Addison's, any dizziness? Do you have any dizziness?
Hmm.
Any uh, abnormal coloration of your skin, your mouth? Any suntan? Do you present? Do you have any suntan?
Dizziness, suntan. Oh,
Yes.
yeah, these are important. Okay, okay, and okay, and okay. How can previous chest infection can provoke diabetes? Oh, yeah, that's actually important. And
Yes.
okay,
Any viral
I think that.
infection? Any viral infection can provoke type 1 diabetes mellitus, or can also a minor infection can cause devastating effect on type 1 diabetes, uncontrolled type 1 diabetes mellitus. Or
Well, I have
untreated.
another question. That can MODI cause such type of decay, such type of serious flare of blood glucose level?
I don't think so.
Yeah, I also don't think so. So that's good. Okay, and any other thing that has to be done? I know that I actually couldn't
Yes, another thing that
arrange it well.
you haven't asked about her menstruation history.
Yeah, yeah.
That was a big issue because she was suffering from irregular menstruation.
Yeah. What was the cause of it?
That is maybe a autoimmune presentation, or maybe from other problem she's suffering from.
Okay. That's all right. And that's all right.
And
And
also
I
she
think
has
I
a
also
recent
okay.
strenuous exercise, so that can also cause, and also weight loss that can cause irregular menstruation. We don't know, but you should have asked for that.
Yeah.
Okay, that is.
Yeah, I should have. Okay. Any more thing?
I cannot remember much.
Okay, and okay. I think that's all. Okay.